For hip fractures, one of the most common procedures I've experienced is the hip hemiarthroplasty, where we have to put an implant in like this.
There's a core tray and then there's an outer tray. So basically,
This is the extended.
it is, yeah. So if you're just doing a standard case, you could probably just get away with opening the core tray, because this has got all the heads, all the instruments you need, and the 1 to 5, the normal brooches.
Oh, okay. So the head is already here.
Yeah.
So we don't need this?
Oh, well, if you're doing
Because
if you're doing a hemi, you're not going to need the heads anyway, because all you'll have is that plus a spacer plus the head. So
Yeah.
they'll go together like that.
So if you're doing a hemi, we still need to open this.
Yes,
Yeah.
definitely. That's how you get it out.
Yeah.
Anyway, we can start with the system. You've obviously seen this before.
Yeah, we used it. Like I've used it twice. Oh, you know what? I don't know what it's for. It's this one.
So it's
What do you
called,
normally
it's
use
called a lateralizer. So when you do a stem, so you've got your box osteotome,
Yeah,
which goes on that handle there. So that'd be the first thing they use.
yeah,
And then you've got your T-handle starter reamer.
yeah,
1, 2,
yeah.
and then this is optional. They don't have to use it, but it's called a lateralizer, and you
Okay.
can put it on power.
Oh,
and they
okay.
can just use it to open up the.
Okay.
So it'd be step 3 if you were going to use it. And then otherwise from there you'll just go straight to your brooches.
Yeah.
Let's say you'd broach up 1, 2, 3.
Yep.
And then obviously that would be in the femur.
Yeah.
Thank you. So you've got your neck trials here. So if this is a 3,
Yeah.
you're going to need the 2, 3.
Yeah.
Yeah, let's see, 0, 2, 3 standard.
Yeah.
So there's only standard and high offset.
Yeah.
So that's 2, 3 high offset.
This one is like 2 to 3 high offset, and then 0 to 1 high. Standard. Because these ones are
So that's 1, 2, 3, 4,
Oh, yeah,
5.
one.
Yeah.
one is there.
So
Yep.
yeah, so it'd be one or the other. And then if you're doing a hemi, you'll just have your head and your spacer.
What is this for? I mean, this one I've never used it before.
Yeah, it's a very
And
good
this one.
question.
Plastic snap rings.
Because these just go in. So this is a 0. So there's only 4 sizes. I actually don't know.
Really? Yeah, I don't know either. I've never used it.
Plastic snap
I'll
rings.
have a look on this.
Yeah.
So this is
They're just a
sizer.
template size. Yeah. Because obviously you'll cut
The size the
head
head,
off,
yeah.
and then they'll just use that as a template. So yeah, but with the C-stem, that's basically it. Done.
And then they said that this is the sizer for the centralizer.
Perfect. Yeah.
And what is this one? What is this one for?
So we have, you know how you use a hardened cement restrictor?
Yes. Oh,
So
it's
this
like
is
that.
for. There is also something called a restrictor, which don't worry about it because you're going to use the hardened.
Okay.
Yeah.
Okay.
Because C-stem has like specific sized
Okay.
restrictors, which is these,
Okay.
which would go on this handle, but I don't think that the surgeons are going to use it.
Yeah,
I
no,
think
they
they're just
don't.
gonna use
They
hardened,
don't
So
really
it doesn't matter. Just ignore it.
Yeah.
I didn't use it since it came.
Need to know.
But wait a minute. So this is like to measure what size cement restrictor, but because we don't really use
You're
it.
just going to use a hardened for everybody. So
Okay.
there's no point.
Okay.
Yeah, just.
And
I
then
know different.
okay.
can
And
ignore
then
this
this
one
one
as well.
is to measure the centralizer.
Centralizer.
Okay.
Yeah, yeah. They're usually a 10 or 12. 10, 12, 14.
So yes, we need all of this, plus the basic trays for soft tissue, and retractors, and the blades, and the scissors.
And this is the
I remember the extended tray has the smaller ones.
Yeah.
Which is, what is this?
CDH, which
What
is
does that
teeny
mean?
tiny. It's like
Okay.
dysplastic.
Okay.
Yeah. And then 1A, 2A, 3A,
Okay. And then the really big ones.
6, 7, 8.
Okay.
Yeah, so 1 to 5 is like your standard.
Okay.
Yeah. So once you've... Okay.
So this is the trial, and the actual implant is opened fresh from a sterile packet.